Did you know that stroke signs can be subtle and often ignored, especially in women? This oversight can be deadly. In this video, we'll reveal these critical warning signs and show how early detection can save lives. According to the American Heart Association, women have a higher stroke death rate than men in the United States. Your attention to these details could be the key to saving your own life or that of someone you love. Understanding these warning signs could mean the difference between life and death for you or a loved one. Watch until the end to learn how you can protect yourself from this silent killer and discover essential prevention strategies that could save your life. Sign number 1 is sudden weakness in the face, arm, or leg. Women may experience a sudden loss of strength or sensation, making it difficult to lift an arm or smile. This symptom usually affects only one side of the body and can range from a mild tingling sensation to complete paralysis. One way to notice this sign is through the smile test or raising your arms. Ask the person to smile or raise both arms over their head. If one side of the face appears droopy or one of the arms begins to drop involuntarily, this could indicate a stroke. Sign number 2 is sudden mental confusion or difficulty. Speaking or understanding, women may have sudden difficulty speaking clearly, stammering, or understanding what others are saying. This is one of the alarming signs of stroke that may be more pronounced in women than in men. During a stroke, when blood flow to an area of the brain that controls language is interrupted, the ability to process or express language can be immediately affected. This can manifest as aphasia, which is difficulty speaking or understanding words. The person may speak in disjointed sentences, use the wrong words, or simply be unable to say anything. Sign number 3 is vision problems, blurred vision, double vision, or sudden loss of vision, especially if it occurs without explanation, can be a warning sign of a stroke. This symptom can manifest in different ways and is often overlooked or attributed to other less serious causes. Vision problems during a stroke occur when blood flow is interrupted to the parts of the brain responsible for vision, resulting in temporary or permanent damage. Recognize this sign by assessing visual acuity, the ability to follow objects with your eyes, and the pupil's response to light. Sign number 4 is difficulty, walking, dizziness, loss of balance or coordination. Women may experience sudden disorientation, lack of coordination, or severe dizziness without a familiar or apparent cause. This can be a strong warning that you are having a stroke. These symptoms indicate that the stroke is affecting the parts of the brain responsible for movement and spatial perception. When the blood supply to these areas is disrupted, it can result in sudden disorientation and difficulty walking. A practical example is when a person suddenly feels unable to walk in a straight line, trips frequently, or is unable to stand without support. Sign number 5 is severe headache with no apparent cause. A sudden, intense, unexplained headache may be a sign of a type of stroke called a cerebral hemorrhage, where bleeding occurs inside the brain. This headache can be significantly different from any headache the person has experienced before. It occurs when bleeding or blockage in the brain increases pressure inside the skull, causing sudden severe pain. A practical example is when a person suddenly develops a headache described as the worst of their life, possibly accompanied by nausea, vomiting, or extreme sensitivity to light and sound. Sign number 6 is unexplained fatigue, extreme tiredness, or a sudden feeling of exhaustion. For no reason may be a specific symptom of stroke in women. This type of fatigue is not relieved by rest or sleep and can seem disproportionate to any physical or mental activity performed. This sign appears when the area of the brain responsible for energy and alertness is affected by the stroke. Diagnosing this symptom can be challenging, as fatigue is subjective and can be attributed to many other conditions. Sign number 7 is sudden changes in behavior or confusion. Unexplained changes in personality or severe confusion can also indicate a stroke, especially in women. A stroke can directly affect areas of the brain responsible for cognition, perception, and emotional regulation. The affected person may act disoriented, not recognizing familiar people or places. Another common situation is abrupt mood changes, such as suddenly becoming aggressive or unable to perform simple tasks that require decision-making. And can you prevent a stroke? Recognizing these signs can make the difference between life and death. Women have unique risk factors for stroke, including history of preeclampsia or eclampsia during pregnancy, use of hormonal contraceptives, postmenopausal hormone replacement therapy, and migraines. Managing controllable risk factors like a healthy diet, regular exercise, controlling blood pressure and diabetes, reducing alcohol consumption, and eliminating smoking can help prevent strokes. What can you do to treat a stroke? Immediate treatment for stroke may include medications to dissolve clots, prevention of additional clots, and in some cases, surgery to reduce damage to the brain. The speed of diagnosis and receiving medical care is crucial for recovery. Recognizing the 7 most common signs of stroke in women and seeking prompt medical attention can significantly improve recovery chances. Did you find this content useful? Do you know someone who has experienced a stroke? If so, leave your comment below and share this video with friends and family. Your engagement can help others recognize the signs early. Check out the recommended videos on your screen now for more valuable information. Also, you might be interested in the products linked in the pinned comment, which could help with stroke prevention and recovery. Thank you for watching, and stay healthy.